I think the vascular surgery program here at Duke has a number of strengths. I think it's led by the faculty's commitment to education to our fellows. Secondly, I think the diversity and complexity of the cases that we see here at Duke allow for our trainees to come out having a broad exposure and experience and really have an enriched education. I think I've enjoyed the camaraderie. You know, Duke is known for being a high-powered academic institution, but it's a very intimate setting. It's in a small city, and you get to know your colleagues well, you get to know their families, and then you get to interact and collaborate with some brilliant people that in larger cities or institutions you may not necessarily get to cross paths. So I think the camaraderie here is really something that I would say is one of the best aspects or attributes.
Duke has a very large open vascular volume. They do a lot of open surgery here, whether it's here at Duke Main Hospital, which is like a tertiary quaternary referral hospital and receives a lot of complex cases in vascular surgery, or whether at our community affiliates or at the Veterans Health Administration Hospital right across the street from Duke Main. All of these clinical sites offer an extremely broad exposure to vascular pathology and allow the trainees to really learn the art and practice of vascular surgery well and be prepared to go into practice following graduation from residency. For me, that was the biggest draw to Duke Vascular, is knowing that I'll receive a broad exposure to any kind of problem that vascular surgery deals with.
In thinking about how Duke is different from other places that I've been, I think that the focus on the entire general surgery residency is really remarkable. In so many places, it feels like the Department of Surgery is fragmented and that there are so many small divisions and factions that have their own autonomy that it's easy to lose sight of being a big part of general surgery. Here at Duke, we have a combined M&M conference, we have combined grand rounds, and all of the general surgery residents rotate through the major specialties and divisions. And so that's something that I really value here because I think it all keeps us focused on the same things. I did not know how much I would and wouldn't work with the Duke residents. As it turns out, working with the Duke residents every day is not only a big part of my job, but it's actually the best part of my job. And what I enjoy most about working with the Duke residents is the chance to see them grow. I have a very high volume service, and most of the residents, when they start with me, have done very little, if any, vascular surgery. And by 1, or if I'm lucky, 2 months with that resident, they have gone from timid and unsure to having a really good skill set and being ready to really do vascular surgery and anastomoses. And that's just so great to watch people gain that confidence and also to see them carry that confidence into wherever they end up going.
I think that the clinical volume and diversity are really the biggest strength of our training program. We have very busy vascular surgery services at 4 different hospitals, and there isn't anything in vascular surgery that we aren't doing, and really doing a lot of. I also think that we have some unparalleled opportunities for academic development. There's a tremendous amount of research going on throughout Duke University, and our residents have the opportunity to be a part of that. We have 2 dedicated research years when our trainees can pursue academic interests and get themselves ready for potentially an academic career.
I would say residents in Duke Vascular are set apart by the sense of fun that we have. I think, most programs are gonna be full of people who are smart and want to take care of patients and motivated and want to learn. But I do think that what really sets Duke residents apart is the fact that we really enjoy spending time together and spending time with the team. And in a field like vascular, especially at Duke, where the schedule the night before is almost never what happens the next day. It's really important to enjoy spending the time together and the twists and turns that the day might throw at you.